Yeah, hi everyone. Thank you so much for joining us today. My name is Toby, and I am the Innovators Toolkit Coordinator here at SciCity. Just for some context, the Innovators Toolkit is a SciCity workshop series that brings experts from a wide range of industries to equip attendees with tangible skills and takeaways that can be used immediately in your own work. And yeah, all Innovators Toolkit workshops are free and open to the public. So with that being said, welcome to our second session of this season, which is Inclusive Innovation and Product Incubation with Gabby Capone, who is also a fellow Yale alum with Yale Law and Yale SOM. So yeah, before we get started, we normally start off with a land acknowledgement, which I'll read real quick. So Yale University acknowledges that Indigenous peoples and nations, including Mohegan, Mashantucket Pequot, Eastern Pequot, Skedikoke, Golden Hill, Pagasa, Nahantic, Quinnipiac, and Algonquin-speaking peoples have stewarded through generations the lands and waterways of what is now the state of Connecticut. We honor and respect the enduring relationship that exists between these people and nations and this land. So with that, as I said, now I'm really happy to introduce our speaker for today, Gabby Capone. Gabby leads social drivers of health, incubation, and strategy through the CVS Pharmacy Design and Innovation Lab, which is a group that leverages behavior change innovation to support over 70 million people. Capone received her JD and MBA in 2019 from Yale and a BA from Swarthmore College. Her experiences include advancing innovation methodologies and multi-sector coalitions to drive change. Capone has designed global open innovation programs for cities to leverage technology and crowdsourcing, and she has written on open data and public participation to elevate public institutions. Her background spans fintech, including building data science tools for economic development at Locus Analytics and driving COVID-19 research efforts at Bridgewater Associates, as well as consulting for technology startups, nonprofits, and philanthropy like Schmidt Futures. So as you can tell, we are in great hands today, and I'm sure you're all just as excited as I am to really hear about what Gabby has to share. Before we start, I do want to make a note that this is going to be a little bit of an interactive session, so we're really excited to have you all engage. Throughout the workshop, feel free to utilize the chat feature or raise your hand at any point if you have any questions. At some points during the presentation, we'll also encourage you to turn on your cameras if you're comfortable with that. And with that, all of that being said, now I'm going to go ahead and hand it over to Gabby to kick off this session.
Thank you, Toby. Appreciate the introduction. I love that opening statement. That's really powerful. And I think probably sets a great tone for many gatherings, but certainly for today's. Thanks, everyone. It's great to have you here. I'm really excited to be back. So big thanks to Toby, Zoe, and the SciCity team for having me and giving us this space for conversation. I'm gonna jump in and share my screen. And while doing that, as Toby mentioned, definitely looking for an interactive conversation today. So think dialogue, think ask questions, think that chat is going. Please feel free, want it to be engaging and really meet the interests and curiosities of the group. So don't hesitate to play chat. I really can't see anything else here. So actually, let me put the chat. Speaking of which, okay, tracking that. And can everyone see my screen? Perfect. And I'm going to just also adjust this so I can see faces. Thanks to those of you on camera. Also see some profile pictures. So great to put faces to names. So welcome. Today's session is going to be focused on thinking about innovation methodologies and in particular, like what it means to do innovation at scale. So I'll be coming from the perspective of CVS Health, specifically CVS Pharmacy, and really thinking about how we can do innovation for larger populations while also prioritizing and elevating the voices of groups within our broad patient population. We're also going to talk about aligning financial incentives and driving towards social impact and how this can build more sustainable business models, particularly when building new products for people. We're also going to talk about inclusive innovation. You're going to learn what it is, as well as design thinking, which I know SciCity has put on a lot of great programming around design thinking. So for some, it might be a refresher. For others, it might be new. We can click in there as much as needed for the group. But overall, I think what we're going for today is we're going to have CVS as an example of a lot of exciting methodologies. And then we're going to be going into workshop mode where so as you know, I'm coming from the law school as well as SOM. If you're not in the business setting right now, that's not going to matter. So fortunately, if you are, this will be, I think, a great complement to the curriculum at SOM. But if not, this is really thinking about ideas where we can align incentives, which I think, fortunately, we go through that in so many disciplines. A bit about me, I think Toby gave the spiel, so I won't spend too long here. But proud alumna, graduated in 2019. Back in my day, I remember City, I think it was City was on Elm in York. So it was in like a different building, and I'm very excited to get back and see all the new stuff there. Now that the center is just taken off, absolutely amazing. Mix of backgrounds across sectors, but I'm happiest when I'm thinking about people and how to bring people into problem solving. So that's the common thread I've been trying to go for, and it's definitely a journey. While we're here, I know we have a group of about whatever number this is. We have a small-ish group. I wonder if maybe we could just go around. I'd love to hear from everyone if you're able to come off mute, your name and affiliation, and maybe why you're here today. And we can go alphabetically down the participants list. And Toby and Zoe, I might skip you. Great. So Alberto, let's start with you.
Okay. Hi, I'm Alberto. I'm a joint degree student between SOM and YSC. Interested in innovation broadly, especially when in relation to environmental issues. And I'm also here because I know Gabby.
I let everyone know you're my cousin, so cat's out of the bag. Great, thank you, Alberto. Andrew? And if you want me to skip you, just throw up a message, skip. We'll move on to Anya.
Hi, everyone. My name is Anya. I'm actually Gabby's former colleague from CVS from the lab. And now doing similar work at Amazon.
Great to see Anya here as well. She'll have a lot of context for this work, actually. Caitlin.
Hi, everyone. Let's see if I can get on camera for a second, at least just to say hi. I'm hanging out on my couch with my daughter, so I'm kind of informal right now. But hi, I work at Amazon right now. I'm actually going through the spin down of Amazon Care. So I'm really interested in this space. My whole career has been in healthcare, and I was connected with Gabby through a colleague and really interested to learn about this work.
Amazing. Great to see you face to face, Caitlin. Crystal?
Hey, I actually worked with Gabby at Bridgewater as well. And so when I heard she was talking, I'm interested in the topic. And so I wanted to join and see what it was about.
Hey, Crystal.
Hey.
Amazing. I saw Ethan.
Hello. Hi, my name is Ethan Lund. I'm in transit right now. That's why my camera is off. But I'm a fourth year PhD student at the School of Engineering. I'm a generalist, or just kind of an explorer. The topic spoke to me for reasons that I can't articulate. So I'm here to learn. Thank you very much.
Thank you, Ethan. Love that. The beauty of the virtual world. Christine?
Hello, everyone. So I'm a first year Master of Public Health student at Yale School of Public Health. So I'm interested in doing technology innovations, especially on wearable devices. So I wish to learn more about the business side in order to build my startup in the future.
Amazing. Monique?
Sorry. Hi, I'm Monique. I am an assistant professor at Yale Medicine, but I'm in MBA first year. And yeah, very interested in actually moving to the side of starting initiatives in health equity, broader initiatives in health equity, since I've served as a clinician for many years. And that's why I was interested in this.
Wonderful. The names are moving around here a little bit. Steph?
Yeah, hey everyone, my name is Steph Kim. I'm a first year MBA student at the Yale School of Management. And this really interests me because I want to strengthen my design thinking skills and for the purposes of advancing health equity. And so this topic in and of itself is really sort of interest to me, just in the context of healthcare. Also, Gabby, I don't know if you remember, but we spoke, I believe in January when I was like making my decision about coming here. So it's great to reconnect.
Oh, full circle. Wow, this LinkedIn post just really, I'm so happy to be seeing so many faces right now. Really also to hear about the areas of interest. We'll keep going, but I think there's a lot of connections already. Stephen?
Hi, it's Stephen. I'm still outside, sorry. I'm MAM program student here in SOM, and I'm just purely interested in today's topic. So looking forward to your sharing. Thank you.
Thanks, Stephen. I think Sylvia.
Oh, hi, I'm Sylvia. I'm SOM. Also, I'm AM program. I'm pursuing concurrent degree with SOM and Hitotsubashi University in Japan. Before MBA, I worked in tech, in finance functions. So, but I want to make a pivot into like product management. So that's why I'm here. Thank you very much for sharing today.
Amazing. Thank you. Thank you. Did we miss anyone? Great. So I think we already hear here that this type of topic draws people from a lot of different backgrounds and disciplines. So particularly after this, encourage everyone to stay connected, can work with Toby to do that if we want to share information or see if there's any ways we collaborate out of here. But hearing a lot of really exciting journeys, pivots, ideas that are percolating for everyone. So this, I think, is going to be a great foundation for today's conversation. So a little bit about the design lab in CVS Pharmacy and where I'm coming to you from. CVS Pharmacy is actually part of CVS Health, which is a broader company that includes businesses like Aetna and Caremark. And within the pharmacy business, and these are the pharmacy and convenience stores that you know and love, about 9,000 of them across the company, we have a design and innovation lab that's focused on supporting the pharmacy business and really doing so with a patient first lens. So we're really thinking about how can we understand our patients, understand their needs, and develop new products and opportunities that drive the business and meet the needs. And Anya is very familiar with this. If you want to reach out to her in the future. And I think what's really interesting and why I put the structure of the team up here is because this is also an example of a corporate innovation team. So I think there aren't often models out there that I've seen. And so I thought it might just be a helpful reference for this group if you do want to see what it's structured like. And so here you can see we have a mix of experience design and strategy. So this is really like an internal consultancy that applies design thinking either to problems that the team identifies or partnering across the business to help other teams apply design thinking to their business areas to uncover opportunities. And we have that coupled with incubation, which is where the team that I lead sits. And the incubation team is really out there taking those ideas. Maybe our partner team came up with it and we're going out there and we're actually testing them. We might be running like a test control type experiment to understand, hey, is this product or concept going to be valuable? Is it having an impact on patients? Is it helping them stay on their medications? And so we'll get a little bit more into that, but this is a cool blend, I think, of design thinking and really thinking about patient and human-centered research. So this isn't just for healthcare, it can be whatever industry you're in. And then also getting in there and testing and being able to prove things out. So mentioned it before and heard it a few times. The design thinking is really integral to how this group operates, both from developing areas that we can go after from a business or opportunity perspective, and also understanding our patients and building new solutions. So if you're not familiar with the design thinking method, it's really a problem-solving method that puts the human or the person that you're actually trying to support and solve for, like right at the beginning, and really anchoring the process around it. And so it's a very high empathy process, really understanding the problems that your customers or community members, it could be really anyone, might be facing, getting really into what that problem looks like, brainstorming solutions. So if you hear design thinking and you think sticky notes, the ideation phase is where all the sticky notes come in and you have really expansive brainstorming around how to solve the problem. And then you get into prototyping and testing to see if you actually have a proof of concept and something that you can go forward with. And typically you're looking to take things to scale. So company like CVS, where we're serving 70 million patients, the word scale comes up a lot. Startups, the word scale comes up a lot. But if you get into more maybe community or local settings, scale might not be as big of a factor, and maybe you can stay more localized. So that one I think can really depend on the context you're in. But what's really powerful about the design thinking method is it's putting people first. It's helping people who might not be experiencing the problem to really empathize and apply their thinking or their capabilities or resources to get at the problem, and to do so in a way that really resonates with the people affected by it. So I wanted to throw this up just to keep it fresh. So we are going to be going through a few things in this presentation where I think this is just a really good lens to have. And you have something to show for the design thinking process too. So I wanted to flag here just different types of wins that we've had in the lab by applying this process and really putting our patients first in the case for our industry. But it could be whoever your customer or user or person is. And so for us, wins are things like time spent actually talking to patients, supporting caregivers who might manage care for patients or for their household, making connections across the enterprise. And then there's also like the numbers around how many ideas we come up with, how many things we get out there and test, new ways to communicate with patients. So we'll be going through some examples of what these are. But I think it just shows that the design thinking method is so powerful. The D&I club at SOM is absolutely amazing for all those who can access it. And if it's a method that you haven't come across, I know SciCity has some good content on it. And I think it's definitely worthwhile if you're interested in the innovation space. So that's kind of laying the groundwork. And as you know, we're going to be talking through the pharmacy perspective, but keep an open mind. So whether you're in healthcare or we heard interest in kind of more environmental spaces, whichever your industry, we'll be able to think about it and what we talk about next through this lens. So I want to talk about kind of the opportunity that we have before us if we're building products. And it's this idea of a double bottom line opportunity. And so the thinking here is this can be an approach to building products where you're really balancing economic value and social value. And so rather than just going for the classic bottom line, the idea of the double bottom line is really integrating having financial impact with actually driving concrete social value. And so in the case of healthcare, we might think of this as improved health outcomes. So for instance, we might say, hey, we actually want to not only drive vaccinations in a community, but close vaccination gaps between patient groups where we see like systemic disparities. And what's really powerful about the double bottom line is it's a mechanism that lets you think of really creative and newer business cases at the end of the day by introducing both this constraint and qualifier that actually we have multiple goals we need to hit here beyond the classic bottom line. And the reason I call out that this is goes beyond healthcare and really goes into any industry is we also have a triple bottom line concept, which I won't talk about directly today, but you could think of environmental value and environmental impact. Can you drive like system regeneration through a triple bottom line proposition? That's another model that gets used as well. Haven't gotten there yet for my team. So we're going to be staying focused on economic and social value, but I imagine you could see a combination between any of these. And ultimately, the reason I think this is a really great way to start framing is because often when we're building products or thinking about delivering things to people, we have a lot of incentives to align. There's always going to be a lot of stakeholders. And so this is really a framework that if we're thinking about social impact and things that can really drive community change or really resonate with the community, it kind of brings it and puts it front and forward and makes it equal, particularly if you're in like a for-profit setting, ties them together. So I wanted to give some examples of organizations doing this. So these were just the two that came to me at the time. But so one is this company called MedHall, and they provide transportation to people with reduced mobility access. And what's interesting is actually providers and hospital systems pay for this transportation service for patients. So there can be a big gap and issue in people actually being able to get to medical appointments or be able to get to the hospital for diagnostics or preventative care. And actually, this is a big waste problem for provider and like doctors' offices where they'll spend time, they'll spend money booking, it'll get missed. And so MedHall kind of came in and targeted providing a service to patients who have the hardest time working in the transportation system and like accessing healthcare, and then set up a system that then providers and insurers have a big stake in covering because it helps these patients get care, which is ultimately good for their business. So I think that one's a really nice example of getting a service out to a group that it's designed for and can really benefit from it, and then also bringing in who else can benefit from this. I think Grameen Bank, if you're familiar with microfinance, also does this quite well. And so Grameen Bank, it's like the OG microfinance lender and really focused on providing small scale loans to communities in extreme poverty. And the thinking here is not only can Grameen actually get a financial return on these loans, but the impact that they have in promoting economic independence, development, resilience, in supporting really families and households is pretty amazing. And so I would say that's kind of another double bottom line venture. And I think they have some very cool stats I was just going through, but for instance, like the majority of their recipients are women, which I think there's another lens of social benefit to that and gap closure. So this is this idea of a double bottom line. And I think it's important because it's helping us get an approach. What are the products or ideas? What are they coming in the context of? How are we really going about work? But it's not perfect. So I'm curious here, like as we're going through this, do any challenges or any challenges come up to you or questions you would have about this approach where maybe you're a little suspicious?
I know for me, one that comes to mind perhaps is while like there's social value and social sustainability, like are there challenges in terms of like company sustainability? So like from a funding perspective and kind of, I guess like funding these like kind of ESG focused initiatives with that like double bottom line approach?
It's a great question. And I think this one, I really think back to my time in like academia and in the nonprofit space where you might come up with an amazing program with great impact, but it might be on this grant cycle. And so if you can't get the grant funding, maybe it ends after 3 years or 5 years if you're lucky. And it's hard to maybe get things institutionalized. And so I think that's really the theme that your question's getting at, Toby, is how do you kind of institutionalize something like this and make it sustainable and long lasting? My hypothesis is that in like a corporate setting or a formal setting, this is probably going to be easier to sustain than like a philanthropy or maybe corporate social responsibility type program, only because you're trying to ingrain the social impact you're trying to have or the environmental impact with the core business. And so that's why I think this is a particularly powerful model for for-profit organizations, I think startups as well, and especially like more established startups and more established companies where you might actually need to be thinking about how do I actually add to this base of what already exists, or you might set out and have a double bottom line purpose to begin with. But I think this can be an effective narrative for those more established companies. Like, isn't that like a charity thing? Isn't that a philanthropy thing? It's like, no, actually, like this is a viable opportunity and here's how we can align incentives. So it's not, it doesn't solve all the problems, and we need, I think, everyone working everywhere to make change, especially on the big public problems. But that's what I think is effective about this approach.
Something that I wonder is for like coming from kind of like an advocacy background, my question would be for leaders who may think that this is kind of like it's zero sum in a way, like by focusing on one, you're taking away from another. Like how do those conversations go? Is it a matter of then like prioritizing, and that in what situations would you prioritize one over the other versus talking about it in a way that this overall is actually very good for the company and it's not necessarily like something that you choose either or.
Steph, I love that. And I think that's really like this false choice that comes up a lot. And especially when you're in maybe a setting where you're trying to blend multiple stakeholders, multiple incentives, like lining people up, and you might not sit fully, you might not be fully of one corporate or team, or it could be government stakeholders, it could be whatever. And so I think that's where the types of things that really you might learn in like your MBA course, or in thinking about critical thinking, or just really presentation, like how can you communicate and translate like what's happening for the audience? And I think it's a very tactical response to your question, but I think often that translation piece of just helping people understand, like, how does this impact what I'm going after? And making that connection, I think actually goes a very long way, but it takes really understanding what they care about and what they're going after, and being able to draw that line and also have it be compelling. But that happens to us a lot in our setting, where like we're not fully of corporate social responsibility. And it seems like for some reason, this zero sum thinking, we're not fully of like maybe a growth initiative. And so like correcting that too, I think to your question, is really powerful. Amazing. Well, those were two really meaty themes. Thank you, Toby and Steph, for throwing those out there for consideration. And I think what I want to do now is tell you a little bit about how we actually take this double bottom line approach at CVS. And so our work is really anchored in this idea of social determinants of health. And so if you have maybe public health exposure, this might sound familiar. For those who haven't, these are really the factors that determine health outcomes, but they're non-clinical factors, quote unquote. And so it's this idea where you live, work, play, thrive, pick your verb, really has an impact on what your actual health outcomes are. And so this is a core, I think, core theme in public health, and particularly with the pandemic. I think increasingly SDH, social determinants of health, have risen in like being this important concept, because they basically encourage us to think about the whole person and all the factors in their life and how that's impacting their health outcomes. And so for others who are in healthcare full time, please definitely correct me in the chat or add into the discussion here if you have perspectives, as I'm sure you do. But I think some that I want to highlight here for the uninitiated are thinking about things like education, income, race and ethnicity. These might be factors on an individual level, on a community level, that are impacting health outcomes and leading to disparities between groups. And so, for instance, we might see lower educational attainment being directly correlated with a lower life expectancy in the US. We will see that like race, ethnicity will have a direct impact throughout diagnostic process, treatment process, and outcomes process for a number of conditions. Here we highlight in breast cancer, a lower rate of diagnosis for Black women. So it's really, they're really challenging statistics that we have to grapple with in this country. And so that's, and not only statistics, but like the systemic factors causing them. So obviously this could be a whole presentation in and of itself, but I want to highlight that this is actually where we see ourselves playing at CVS, which for me is really exciting, because at a company like CVS, we have this great chance to have impact. We've got broad scale. And so for us to be thinking about things from this lens, it gives me hope And I want to talk a little bit about how this is actually really good for the organization as well, in addition to being the right thing to do and good for society. And so, as you can probably guess, our double bottom line is really thinking about our healthcare business and thinking about the gaps that are coming up in our patient populations and communities because of the factors and many others that I highlighted on the previous slide. And so what does that mean? Like, how do we actually get at that? And one of the methods we use to bring that to life is this idea of inclusive innovation. There's actually a few different types of inclusive innovation. You can think about inclusion in innovation, so like the representation of voices in innovation. In this case, we're talking about inclusive innovation as a method where you actually design around the needs of a small group or subpopulation or area. And then in addition to solving their needs and understanding them, you also extrapolate and pull out the learnings that you have like, to your broader population. So as you might be kind of thinking about this and the gears start turning, this lets us really do a lot at a place like CVS, where we are thinking about 70 million patients, 80 million patients, but we want to create space to go after and really address in a deep way populations that have not been the priority for design, that have not been the priority for product development. And so this is one way where we can not only design for those patient needs, but also pull out those learnings for the broader business. I'll talk, there's some caveats to inclusive innovation, as you might also guess, but I'll tell you a little bit about like what this actually looks like. And so pulling together this idea of being double bottom line and thinking about the social determinants and what are the factors really impacting our patients. We might do some, Anya, this is gonna look familiar. We might do some really deep dives into what our patients' experiences are and really understand the points in their health journey where they need support. And so in this case, this was a study done on the experiences of Black mothers-to-be and who are CVS patients, and really understanding like what their particular journey is like, what are their blockers, what are their concerns, and really getting into qualitative methods. So going back to the design thinking approach, empathy. So this was our empathy phase. We were just trying to understand, and unfortunately found like a lot of gaps. And some of these gaps pharmacy touches, some of them we don't, but understanding this full picture and where we can play, that was kind of the first step. And then from there, we were able to build this like double bottom line value proposition, that being an ally to, for instance, like patients who are Black mothers who are mothers-to-be who are expecting, but being an ally to these groups who really need support and designing for them specifically, can give us a few kind of calls to action that CVS can take on as we learn and flex muscles here, and like aren't going to get everything right, but we're going to try our best and kind of put a step forward. And so we found that in being an ally to patients, they're concerned about getting expert health information and navigating this complex health system, and so needing help editing and knowing what is important for them to focus on. Similarly, like being able to connect to providers and connect to clinicians. So in our case, we're thinking pharmacists, like you can probably guess, we're usually thinking pharmacists and our store colleagues, and thinking about how we can build relationships so that they can see pharmacists as trusted clinicians. And then third, I think this idea of thinking beyond pharmacy. Pharmacy is just one touch point in a very large healthcare journey system. There's probably a lot of other words we could use for it as well, but helping that patient to navigate through. And so this is really this journey of empathizing deeply with your customer, understanding like where their pain points are, and thinking about what capabilities, what can you bring to the table that's really going to support their needs. And so that's really the flow that we went through. And just to highlight some of the ideas that have come out, both of this design work and other design work, but just to give you an example of where then we get to the product piece of actually ideating and testing, and then coming up with products that can have this double bottom line impact. So I highlighted a few here that are some favorites of mine. the funny thing is, once you start in something like this, you like all the ideas, but I guess you do have some favorites. So the first one is this idea of pharmacist-led webinars. So this is just having clinicians talk about health information in a really accessible way, and really prioritizing pharmacists that patients can identify with. And so one example here was we had pharmacists who celebrate Ramadan talk about what it means to manage medications through the month of Ramadan. So if you're not familiar, in addition to fasting from abstaining from like food and water, you also abstain from oral medication in most cases. And this can create a lot of confusion for patients and have an impact on their health. So we had pharmacists kind of talk to patients about this in a really culturally competent way, and really respectful and build that trust. Another idea that we had was this idea of digital access. So we know in the pandemic that this idea of internet and computer access, I think, became all the more salient to us. We realized, hey, maybe like the entire country doesn't have like blazing fast Zoom. Here we are on video, no problems. It was not like this for me at the start of the pandemic. But in all seriousness, we know rural areas are more disconnected. And so we thought, how could we reach patients who maybe don't want text messages or don't have email? And so we started sending really important health information by mail. This was really cool. We saw a boost in people getting their flu vaccination, and even getting flu vaccinations for their entire household. And then finally, and you'll see a lot of these are about relationships and understanding how people like to get their information. We have this idea of having patients select the pharmacist they want to talk to, and having a consultation on their medication. We found 65% of patients actually had a preferred pharmacist. This was surprising to me because here I am coming to you from CVS Pharmacy. I don't really know what I would look for in a pharmacist. Like, I didn't know. That was kind of one of my questions for this one. It's like, will people care? And 65% of them did have a preference, which was a great learning. And also giving the chance for pharmacists, then knowing the patient has that trust because the patient's made the selection, pharmacists can really get into a great conversation with them and build on it from there. So these are ideas that really came directly out of these design thinking and inclusive innovation approaches, where we're really trying to understand these deep needs and design to meet them, and actually finding these discoveries that can benefit broader patient populations and broader people as well. So just to wrap us up here before we get into, we're going to get into like workshop mode very soon. This is just a little wrap up on inclusive innovation, and this idea that really designing for the few can also benefit the many, in addition to prioritizing the few. I think a few things to keep in mind for inclusive innovation is that it really should be applied with other very inclusive and like human-centered methods. And so I think if you're familiar with human-centered design or not, I think I would always brush up on that in parallel with this, whether you're applying design thinking or other like very interview-based methods, or even this idea of designing with, not for, and can you actually bring the people that you're designing for into the process and having that actually be there. And I think in parallel, having a representative and inclusive innovation team is also a win on so many levels, but I think something to be mindful of and aware of limitations if you don't have that. And I think that the idea of scale. So if you're maybe maybe you're working on like a startup idea, or I don't know. I think about all the ideas that were flying around when I was in grad school. And so something like this might be interesting when you're playing with scale, thinking about an idea that might have a specific focus, but actually if you make some tweaks, maybe others can benefit from that as well in the longer term. And that's a trend we see a lot in healthcare, where because a company like CVS, it's so large, we're playing in the millions. You start to see startups pop up who actually win a lot because they focus really deeply on like this small segment that the larger company says, hey, like that's so small, we shouldn't focus on that. Next thing you know, it's a really amazing business meeting a very specific need. And I think that's a pattern we see a lot across a lot of industries, where you'll see the incumbents say, hey, that group's too small. That's where a startup or new idea can come in. And I think the final thing on inclusive innovation, you'll notice we said from the few to the many, but what if you can stay laser focused on your few? whether it's to that startup idea or really just having that be the end goal. I think that's like absolutely amazing if that's the case as well. You can tell we have certain factors we have to work with here in larger settings, but there's also, it's absolutely amazing if you can just stay really laser focused on your design target. So we're going to jump into just reviewing some of the tools and concepts that we've talked about. And then I'm going to invite everyone to participate in the workshop portion. So I think we're good on time for that. But before I do that, any questions or like things that are sticking in your head coming out of what we just covered? Curious for those who maybe are not as healthcare focused, does this resonate? Can you see this applying in your industry or in your field? Well, we're going to find out in our workshop, so won't be too much of a cliffhanger. I just wanted to recap here some of the tools that and concepts that we've just gone through that we'll be taking with us into the workshop. So this idea of being double bottom line, aligning incentives and really thinking about how you can create win-wins. We can say for economic and social value, or we could say economic and environmental value, depending on how deeply we have some people here who want to go into the environmental view. But I think really knowing this is a mindset and a principle and like a way of doing things. And then we have inclusive innovation and design thinking as methods that we're really applying both to solve problems, but also to meet the needs of our design targets. And so I have some guides here. Maybe I can share this after around like why they're important and when it's best to use them. But just wanted to have this refresher before we jump into the workshop. So the workshop is going to be building a double bottom line case. You can think of it as building a business opportunity. You can think of it as building an opportunity for a community. And the idea here is that we're going to be taking like an industry and a social problem or social area of focus and thinking about how we can tackle them. It's meant to be a little messy, but also meant to really get you thinking in the principles of a solution or going after a solution that balances that double bottom line thinking. And I'm hoping to take a few minutes to set this up, looking to break out into groups of 3 or 4, and then we'll spend time in the workshop sessions and then come back together and hear everyone pitch what they did to the group, which I think will be the most fun part of today's presentation. Looking forward to it already. A few ground rules before we do this. Just take a yes and mentality. So just let's take all the ideas, everything's on the table, be open to them and ensure everyone gets a chance to share in your group. So I'm sure we'll be mindful and understood if folks have to leave for the workshop. Thank you so much. But for those who can stick around, I think it's going to be a fun time. So pretty simple framework here. In groups, you're going to be picking an industry or company or organization. Don't let me constrain you, have fun with it. But pick some institution or organization or industry and a social problem that you really care about. And this is where we can also bring in the environmental aspect. Or if there are other areas of focus here, maybe you're thinking more from like technology or like the idea of, oh, the wearables thing could come up as like an industry or company. So social problem or group to design around. And then I'm going to have just a few kind of key parts of the double bottom line approach and getting to one for you to go through as a group. And so these are just a lot of prompts, but it's going to be 5 steps. And we're just looking to get to these 5 outputs. Thank you to those who have to hop, understood. And so what I'm hoping to do now is break those who are remaining into groups. Well, why don't we pass it to you all first, extra curious about how your conversation went.
Yeah, so we mixed it up. So didn't go the healthcare industry route. So our focus was in tech. And in terms of the social problem or group to design around, we focused on like populations that don't have like access to technology. So specifically, like they don't have the resources to utilize technology. And we kind of define that problem specifically to devices for like video or virtual calls in the US as kind of the like specific problem lens. In terms of understanding, and Alberto, feel free to jump in if I say anything wrong. But with understanding the impact, we felt like there were a lot of like different kind of impacts kind of spanning across industries, honestly, in terms of relating to like lack of accessibility within this like video virtual technology space. So like an impact on like education, especially like in this day and age with the pandemic, like a lot of students were having to do like virtual learning. So like if you don't have like access to like video or like virtual, like Zoom, for example, like that's definitely difficult. Healthcare with like telemedicine and just like virtual visits. And then just in general connection to others and like specifically like elderly care. So like people like really wanting to like check in on like family and relatives and like really being able to kind of see them and add like more of that personal touch. And going from there with the align incentives, that was kind of a lot of brainstorming on our part, but essentially we saw like there's kind of like incentive both like with the larger population, but also like from like a business and corporation standpoint. So like talking about it, we were like, I'm sure like a lot of people would like take technology if it's available to them, like probably wouldn't turn down a phone. Now some people might, but I feel like in this day and age, maybe not as many people. And then from like a company perspective, like there are like companies, a lot of them producing these technologies. So like if there is some kind of like partnership or incentive where it's like there is a lot of demand for this, like that could increase like their product distribution capacity. I don't know if you had anything to add there, Alberto.
Yes, we were thinking about how partnerships between companies in different sectors could create incentives for someone to supply technology equipment. The different scenarios that Toby mentioned, like healthcare, education, connection, we thought of different ones. For healthcare, we were thinking like big tech and companies like CVS that have insurance companies, but we were thinking CVS because of the retail spaces. Big tech's incentive would be like data or Amazon, I don't know, being able to sell to people. For education, we were thinking the incentives between publishing companies and education organizations like schools would work. So a publishing company might want kids to have tablets so that they can sell or license the school's textbooks, creating like future revenues to make this sustainable. So we could have publishing companies, a tech company supplying the equipment, schools. And then what was the next step? I think I skipped to sustainability, but there was something else.
There was also opportunities, which I feel like you kind of covered too. I don't know, as we were kind of talking through it, I think maybe we didn't take the best approach, but we saw like some overlap in terms of like the opportunities and the incentives, and then kind of how that could tie into like the sustainability piece too.
Yeah, and in sustainability, even though it's what I initially said wanted to focus on in the call, we focus more on like financial sustainability than like how to keep this model going, not so much like the environmental side.
That was right. I realized sustainable might have been misleading on that one, but yeah,
No.
sustainable in terms of financial viability, which you got it. Amazing. I mean, such an interesting space. I think companies like Hinge Health, if you've heard of them, like they're basically companies that are thinking like, how do I give someone something in their home so that they can better engage in virtual life? And something like a tablet or like a computer might be foundational to that. So a lot of interesting ideas there, and think about that access lens. Steph is going to share what we discussed in our group.
So we went the healthcare route, and we were thinking about access to care, particularly for like people who get pregnant. So the problem that we decided to really focus in on was the fact that women receiving no prenatal care are 5 times more likely to have a pregnancy-related death. And so with this, we were trying to think about some, root causes. So a few things that came up were potentially maybe there's a gap in terms of education and awareness of a need for prenatal care. There's also potentially a provider shortage. And also maybe there's a barrier to actually having insurance coverage. And so maybe there's a barrier to applying for Medicaid, or just, there's a lot of sort of administrative headaches that occur in terms of trying to get the insurance coverage, ensuring that you have it all. For understanding the impact, we were thinking of who may experience problems. So we said expecting mothers, and this includes all people who are pregnant. And then we're also thinking about maybe we can also engage with existing organizations. Maybe they're like national organizations that are working on the issue, have already gathered a lot of data, or even local sort of grassroots organizations around sort of like who have been doing the advocacy work already. And that would kind of also be related to how do we build trust? It would be through existing networks. In terms of different questions to ask, I think we had a lot of different we explored a lot of different routes here. Just a few is just asking some questions around awareness. How do they try to find prenatal care? What were some barriers you faced at each stage of the process? We're also maybe asking, wanting to understand, maybe there's some cultural norms and expectations around pregnancy and birth. So we'd want to develop a set of questions to try and really understand, maybe there are some factors there to help us better understand the issue. And in terms of aligning incentives, this one we're kind of struggling with. We're trying to understand, because the issue itself, it's for us, it's just like, this is what you should be doing. We should be working to prevent this from happening. But upon sort of further reflection and brainstorming, we were thinking, maybe it can be, we can target like digital health companies that are really targeting those who are pregnant or are interested, who like want to conceive. That's kind of where we got to, because we were kind of stuck and like thinking through a lot of what to ask. So unfortunately, we couldn't get to the imagine opportunities and make it sustainable. But I'm sure if we had another 5-10 minutes, we would get to a lot of different questions and ideas.
Yeah, and thank you, Steph, for that overview. As you all probably encountered, like defining the problem can often be like the most important exercise, or the one that you spend a lot of time on, and then things kind of flow from there. And so depending on the problem you pick, things can really have a downstream impact. But overall, I know we're coming up on time. So I hope the workshop and really the examples that I shared today just give you a sense of how we can think creatively about the work that we're doing, products we're building, how we're designing and bringing people into the process, and designing for many, designing for people who are not ourselves or not us, and having that be impactful. So thank you all so much. Thanks, Toby. Happy to take any questions, but I know we're a small but mighty group here at the end.
Awesome. Thank you so much, Gabby. I know I took away a lot from this and I really enjoyed it. Really liked getting to do that kind of brainstorming and bottom line workshopping with my group as well. And sure, the same sentiment is also shared with our small but mighty group, as you said. But thank you so much for your time tonight. Super awesome. Were there any questions or?
Most of you know how to reach me, so.
Yes, Gabby, would love to follow up with you.
Yeah, I know. All of you, I'm like, we're going to catch up. So perfect.